Dr. Robert Levine here, talking to you from the Genesee Community Health Center. I'm here to help you with a little more understanding of the COVID-19 virus, the pandemic, to help you understand a little bit more about what you can do to help yourself and help other family members. I really want this to be your source of information. There's lots of sources of information. I recommend that you ignore most of them. The ones that are the most reliable are the Center for Disease Control and the World Health Organization. They both have websites. They're kept up to date every single day, and they are outstanding sources for information. So if you have access to the internet, best thing to do is to look on their websites because they will help you out. So what I wanted to talk to you about was fear. Everybody's got fear. I don't think there's an individual around that does not have some degree of anxiety that's caused from this virus. But we have to look at statistics and let statistics sort of be our friend. And I'm not going to go into a big statistical lecture, but I did want to just go over some high-level basics. Let's say a worst case scenario, somebody contracts COVID-19. What are the chances that you get horribly sick or die from the disease? After all the information that's come in, and it's a lot of information, 80% of everybody, that's 8 out of 10 people who contract the virus, the COVID-19 virus that we're talking about, 8 out of 10 get manageable symptoms or no symptoms at all. That means that you get symptoms like a cold, flu, achiness, chills, basic cold-like symptoms, sometimes coughing, fever, and they're manageable. They're just like a bad cold. That's 80% of everybody who gets the virus. If you got the virus, so if you were to have to go to the emergency room, you got an 80% chance of getting a fairly mild or manageable case. 15% of people who contract the virus, 15% wind up with severe symptoms. That means symptoms so severe they cannot manage at home. They have to go to the hospital. They need extra oxygen. They need IV fluids because they can't, they're sweating so profusely and they're so uncomfortable. They just can't manage at home and they wind up being admitted to the hospital. That's 15%. So that's 95, and they recover and go home. 95% of all people who get this virus wind up doing just fine. They wind up no worse for wear. They're better afterwards, and they survived it. 5% get very sick. There's a very small percentage that get terribly sick and wind up needing help breathing on a ventilator. Of people that wind up on a ventilator, about 50%, from what we have in terms of statistics, 50% of people who wind up on a ventilator are able to come off of a ventilator and recover. So it's about 50%. And again, what determines whether somebody is going to be able to get through it and get off of a ventilator? It's their, previous health conditions. Somebody who's an asthmatic or a chronic smoker, or somebody who has who's obese or has diabetes or other health conditions is less likely to get off of a ventilator if they have other underlying health conditions. So if you look at the percentages, just the percentages alone, 95% of everybody who gets the virus recovers. So we're talking about a very small percentage. There's plenty of people who are frightened of thunderstorms. Go ahead and look up the statistics on getting struck by lightning. It's infinitesimally small. If you look up swimming in the ocean and getting your chances of getting eaten by a shark, infinitesimally small. Of the millions and millions of people who swim, how many get encounters with sharks? It's a tiny fraction. It's less than 1/100th of a percent. Lightning strikes that kill people, again, hundredths of a percent, very, very low likelihood. But that doesn't stop us from fearing it. Anybody who's seen the movie Jaws, always has that primal fear when they're swimming in the ocean, thinking they could be the one. It's hard to get over. It's no different than fear of flying. You've got a greater chance of getting into an accident on the way to the airport and either dying or being seriously injured than you are on that aircraft. But people don't fear driving to the airport. They fear flying, for those who fear flying. So I just wanted to give you a little bit of heads up, a little bit of information, a little bit of statistics to help you understand what we're dealing with, and the fear, the news reports, unfortunately, has driven people to stay away from the emergency room, to do things they wouldn't otherwise do. So just want to help you understand. If you have any further questions, call your healthcare provider. Dr. Robert Levine here from Genesee Community Health System. Thank you.